Our next guest speaker is known, again, to many people, but again, a small story because I've got the microphone. On Wednesday, Rowan Greenland, who's our new CEO. Rowan, put your hand up. That's Rowan. So Rowan's our new CEO at MS Australia and its subsidiary MS Research Australia. And he and I went to Canberra to meet with our parliamentary friends, and we did a presentation. And in that presentation, we referenced a lot of Professor Palmer's work, and particularly the challenge that lay ahead of us. And the point that I think we were making was the research that Professor Palmer did said that the burden, the health economic burden, was $1.75 billion in 2017. Now, MS Australia dedicates $15 million a year to finding a cure and to improve the care, and we do that over 60 funded research programs. We also know that MS Australia, by simply the brand, that we draw in, several other millions of dollars. But the point that we were making to our our parliamentarians was a $1.75 billion health economic impact, and we're throwing $20 million at it. And so we were appealing for their support. And so in the immediate future, there's going to be some consultation with key stakeholders. We're going to come up with a new strategic plan for MS Australia, and we are making a bid for the MRFF on behalf of all researchers. So it just goes to show the connections that between what Professor Palmer did and his team allowed us to represent the researchers, the people with MS, the carers, etc., to argue on your behalf for additional funds. So having said that, come to stage. Welcome, Professor Andrew Palmer.
Thanks, It's a pleasure to be here this morning. I'll just adjust these. Is anyone here a jockey? Or retired jockey? Anyone have anything to do with the racing industry in Tasmania? No one? Last time I was here, actually about 5 years ago, I was talking about the risks and costs of jockey injuries in the racing industry. So as a health economist, we get to talk about all sorts of weird and wonderful things and research weird and wonderful things, but what I'm going to talk about today is just wonderful, not weird. And this is really about research we're going to do on connections. So on connections of people with MS. So it's not just research with connections, but actually research focusing on connections. The kind of, what I'm going to do is give you a sneak preview or sneak peek on a research proposal that we're putting together, looking at the impact of MS on carers and supporters of people with MS. Okay, so really focusing on those carers and supporters, those connections. So I'll talk a little bit about the rationale for our study. I'll go over the health economic impact study that we published in 2018 that Des referred to. I'll just look at some of the pilot data that we've generated, and we need more, but I'll get to that. You'll see some pieces of paper, some forms on your table, and a couple of pens on each table that I'll get you to fill out a feedback form at the end. I'll talk about what we know already and what we're planning to do in this research proposal, this big project. So what we already know anecdotally is that MS has a deep impact on the lives of significant others, carers, supporters of people with MS. To date, a lot of the research has been focusing obviously on people with MS, but there's very scant research on the impact of MS on that network of support of carers for people with MS. And so what we think is that we're really underestimating the total economic impact, quality of life impact, when we're just focusing on the person with MS alone and kind of ignoring that network. And so, Des mentioned, at one point, I think it was $7 billion. which is the economic impact of MS that we estimated for 2017. We think that is a vast underestimation because we've really ignored a huge group of people around the people with MS. What we did see when we just focused on the person with MS was that there was a 40, I need to get a stronger set of glasses here, 41% increase in 7 years in the total economic cost or burden of MS in Australian society. What we can see, I'm going to have to get closer here, mate. What we can really see is that when people with MS have no disability, the costs are relatively low, about 30,000, 33,000 per year per person. As we get higher and higher in the terms of disability, so that increases to 55,000 when you have mild disability. 76, 77,000 when you have moderate disability, and when you have severe disability, those total costs go up to about 115,000 per person per year. On the other hand, when we look at the quality of life impact of MS on people with MS, so just focusing now on the person with MS, you can see that yellow column looks at the average Australian population health utility value. So a health utility value is a number between 1 and 0. 1 represents perfect health, 0 represents death. And if you ask 1,000 people in Australia what their health utility is now on that scale of 1 to 0, most people, on average, is about 0.8. So we surveyed quite a few thousand people with MS involved in the AMS-LS study, that Australian MS longitudinal study. When you have no disability when you have MS, your health utility is just slightly higher. I wouldn't say it's statistically significantly higher, but slightly higher than the Australian average. Once you start to get disability, so move into the mild disability category, that quality of life unit goes down to 0.65, so 65% of perfect health. When you have moderate disability, it goes down to 0.54. When you have severe disability, that goes down to 0.48. So if you put that, kind of summarise that on one graph, you can see the cost increase rapidly for that, just referring to the person with MS, and the health state utility, or that quality of life value, decreases substantially as disability increases. And so what we hypothesise and what we'd like to study and quantify is that as the person with MS's disability gets worse, those carers, the support people, the networks, their quality of life is also impacted in parallel to that. And also the costs associated with caring for those people, out-of-pocket costs and so on, also increase. So there is an official definition of who a carer is. There's a Carers Act of 2021, and a carer is respected and recognised as an individual with their own needs as well, who is a carer, obviously, and someone with special knowledge of the person that they're caring for. We're going to adopt a slightly broader definition, and we'd like to include a broader network of people, so including family members and people in that close social network of the person with MS. What we're going to do is try and recruit people who are carers or supporters of people with MS, and the people with MS will be already enrolled, hopefully, in the AMS-LS study, this ongoing long-term study of people with MS, so we'll be able to track in parallel to what happens to the people with MS, what happens to the carers and that social network over time. So what do we already know? Well, there are no long-term studies that actually show what happens to that social network around the person with MS. There are some small short-term studies called cross-sectional studies, where you ask people a snapshot at a certain point in time what their relationship is, what costs are, and so on, but no one's actually tracked what happens in parallel to what happens to the person with MS. So I think we can do a lot better for the carers and support people with MS by studying this in a lot more detail. So in developing our research program and the kind of things that we're interested in doing, we've worked very closely with MS Australia, MS Research Australia, so you can see Des Graham there and Andrew Potter. We're working with Carers Australia and also people with MS and their supporters and support groups. So it's consumer reference groups. We have done some pilot surveys. I'll just turn that off. Associated with some of the quality of life surveys we've done with this AMS-LS study. But what we really need is a lot more pilot data, and that's why those evaluation forms or the feedback forms are on your table, because I'll ask you at the end to fill out just some questionnaires there. In one of our surveys last year, we asked people with MS if their support group or their carers would like to be involved, or do you think they'd like to be involved in a study, or this study, and you can see the results there. So, only about 14% actually said yes, that they had a support person or a carer who they thought would like to be involved in the study. 29% said no, but what you can see there, that grey area is 48% said it's not actually applicable to us. We don't have a carer, we don't have a support network. So I think that even amongst people with MS, there's this kind of lack of recognition possibly that, there's that network around them that also needs to have their needs addressed. So we're still currently refining our research questions, and we're doing that in collaboration with our partners and consumer groups. And what we want to do is apply for major funding from the National Health and Medical Research Foundation, which is one of the major federal government funding groups, to fund a 5-year study that will obviously link people with MS and their support network. And what we want to do is see how that network changes over time and how, as the disease progresses, obviously roles will change, people will come in and out of that close network. We want to see how that changes over time. So some of our major research questions are, what are the quality of life, health economic or economic impacts for the supporters of people living with MS compared to those, or in relationship or in parallel to those changes of people with MS? What are the health economic impacts or benefits of supporting the carers and supporters? So, can we channel funding? Can we channel support? Can we channel better insurance, for example, or NDIS, for example, better funding towards looking after the needs of the supporters, the carers of people with MS? So our overall aims are to establish the world's very first comprehensive, enduring, prospective, that means following people over time, study of supporters of people living with MS, and that's linked in parallel to the people with MS. So see those changes over time in parallel. We want to investigate the health, quality of life, and economic impacts of increasing progression or disability associated with MS. And we want to translate these findings to the needs of people who support people with MS. In the end, what we want to do is generate information that people like Des Graham can use to go to the government and say we need to improve resource planning and resource allocation to people who are supporters of people with MS. In the end, that will kind of close the circle. So if supporters of people with MS are getting better support themselves, then the care given to people with MS will improve as well. So I'm going to close that circle. In the end, what we want to do is improve the outcomes of people with MS. So if you'd like to get involved, there's a feedback evaluation form on the table. There should be a pen on each table. Please just complete that. just looking at what you think is the relevance or the importance of this potential study. If you are a person with MS who's not part of the AMS-LS longitudinal study, I'd ask you to go out to the desk and sign up to that in the tea break or at lunchtime. That'd be great. And hopefully we can get some funding from the federal government to get this important study going. We already have some funding, partnership funding, so in-kind and real money funding from MS Research Australia and MS Australia, so we really thank them for that. Carers Australia has also given in-kind support. And thank you to all those people who've helped set up this, this meeting today and who've contributed to this development of this research project. Thank you. Throw the floor open to any questions.